years old female present to the emergency department, stripping on a strap. She complains of shoulder pain. On examination, there is difficulty in initiating the shoulder abduction. What is the most likely diagnosis? That means the main problem is the abduction, and there is the problem with initiation of the shoulder abduction. The shoulder abduction, they are divided into the three parts. First of all, the 0 to 15 degree, it is done by supraspinatus muscle. Let's see later. First of all, let's see the answer option. Here the options are glenohumeral dislocation, fracture of anatomical network of the humerus, sternoclavicular dislocation, supraspinatus tear, and infraspinatus tear. So what may be the option? So first of all, let's see the abduction. In case of the shoulder, the first abduction, that means 0 to 15 degree, it is done by the supraspinatus muscle, the muscle which is the supraspinatus or supraspinatus muscle. Then 15 to 90 degree, this is by the deltoid, and then more than 90 degree, it is by the trapezius. So these three important muscles, they function. And here we can see this is the 0 to 15 degree, it is the initiation, 15 to 90 degree, then a step, and more than 90 degree, then 0 to 15 degree, which is the initial phase, it is done by the supraspinatus muscle, and 15 to 90 degree by the deltoid, and more than 90 degree, it is trapezius. So first of all, let's see the rotator cuff tear. The rotator cuff, this is the fibrous structure, and it is formed by four important muscle in the shoulder joint region, such as this one is the supraspinatus, then below the supraspinatus there is the infraspinatus, then teres minor, and anteriorly it is the subscapularis. These four important muscle form the rotator cuff in the shoulder joint, and this rotator cuff, they are the tendon of these four muscle, and it is very common to tearing this ligament or this rotator cuff. So here we can see the another picture. This is the full thickness tear of the supraspinatus. Here this is the partial tearing of the supraspinatus. This one is the supraspinatus. Here this one also the supraspinatus, and below it anteriorly it is the subscapularis. Here this one is the subscapularis, and this is showing the torn of the rotator cuff, including supraspinatus and also the subscapularis. And let's see this rotator cuff muscle. These are the rotator cuff muscle. First of all, this one is the supraspinatus, which lies above the spinous process of the scapula. This one is the spinous process of the scapula. So above the spinous process of the scapula, it is the supraspinatus muscle, and below this spine there is the infraspinatus muscle, and below the infraspinatus there is the teres minor muscle. This muscle is the teres minor. So supraspinatus, infraspinatus, teres minor behind, and anterior on muscle, which is the subscapularis. These four important muscles, they form the rotator cuff. That means they form a fibrous structure which rotates all side of the, or which covers all side of the shoulder joint. So first of all, then see the supraspinatus tear. That means the ligament of the supraspinatus tear, and it is the supraspinatus tear is the most common tear in the rotator cuff tear, and it occurs as a result of degeneration, and it is rare in younger adult. So it is very rare in younger adult. It is common in older region. So what is the answer? The answer is the supraspinatus tear. Why supraspinatus tear? There is problem with initiation of the shoulder joint. That means 0 to 15 degree. So as 0 to 15 degree involved, that means initiation involved, and shoulder joint abduction is initiated by the supraspinatus muscle. So in case of the supraspinatus tear, there will be problem in the initiating of the shoulder joint, and maintenance, it is done by the deltoid, and deltoid by 15 to 90 degree, and more than 90 degree it is done by the trapezius. So our answer is the supraspinatus tear. Other option here such as the glenohumeral dislocation. In case of glenohumeral dislocation, there is all type of movement of lost, not only the abduction, adduction, medial rotation, lateral rotation. Fracture anatomical neck of the humerus, it is also not true, because anatomical neck fracture, it also involve all type of movement. Sternoclavicular dislocation, it is not true, because the sternum, it is located in the central region just below the trachea. And infraspinatus tear, usually the infraspinatus tear is very minimal effect, and the infraspinatus muscle, it has very minimum role or no role in abduction.